Good morning and welcome to Biology Daily, where we bring you the latest breakthroughs in biology. I'm Annalisa Konstantopoulos, and today we're reporting on a rare but fascinating condition known as Cri-du-Chat syndrome. First identified in 1963 by Dr. Jérôme Lejeune, a French geneticist and pediatrician, it's one of the rare genetic disorders occurring in about 1 in every 15,000 to 50,000 births. This condition impacts families all around the world across all ethnic backgrounds. Interestingly, it's seen more often in females than in males. But what exactly is Cri-du-Chat syndrome? For that, we go live to our science correspondent reporting from the genetics lab.
Thanks, Annalisa. I'm here in the genetics lab to answer the questions, what is Cri-du-Chat syndrome and how is Cri-du-Chat syndrome caused? Cri-du-Chat syndrome, also known as 5p- syndrome, is a rare genetic disorder caused by a deletion of the short arm of chromosome 5. It's named cry of cat in French for the distinctive high-pitched mewing cry often heard in affected infants, resembling a cat's cry due to an underdeveloped larynx. The deletion can happen randomly during the formation of an egg or sperm, which means parents usually have normal chromosomes. In a few rare cases, it's inherited from a parent carrying a balanced translocation, a chromosomal rearrangement that may not cause symptoms in the parent but leads to problems in the child. Additionally, the size of the deletion can affect how severe the symptoms are. Larger deletions often result in more significant intellectual and developmental delays. Most children with Cri-du-Chat syndrome often have a normal life expectancy. That's all from me.
Next on Biology Daily, Dr. Janetta Tix on diagnosing Cri-du-Chat syndrome.
Hello, and thank you so much for having me on Biology Daily. I'm Dr. Janetta Tix, a geneticist specializing in rare disorders. Today I'm here to answer the question, how do we know if someone has Cri-du-Chat syndrome? Cri-du-Chat syndrome is usually identifiable at birth due to its distinct physical and developmental signs. It's marked by developmental delays, intellectual disabilities, speech difficulties, and a unique high-pitched cry in infants. This cry, often described as cat-like, is one of the earliest and most recognizable symptoms. It results from an underdeveloped larynx and tends to fade as the child grows. Newborns may also show several physical features including low birth weight, small head, round face, wide nose, widely spaced eyes, crossed eyes, downward slanting eyelid folds, skin folds at the inner corners of eye, low set ears, small jaw, short spaces between the upper lip and nose. In some cases, heart defects may also be present. To confirm the diagnosis, we use genetic testing, typically a karyotype or chromosomal microarray, which can detect the missing section of chromosome 5 responsible for the condition.
Life with Cri-du-Chat syndrome. There's no cure for Cri-du-Chat syndrome, but treatment focuses on supporting development and managing symptoms. Children benefit from speech therapy to help with language, physical therapy to improve coordination and strength, occupational therapy for daily skills, and surgical treatment in some cases for heart defects or cleft palate. Early intervention is key. When families and medical teams start therapy early, children can make meaningful progress and improve their quality of life.
Now, back to the anchor desk. To recap, who is affected by Cri-du-Chat syndrome? About 1 in every 15,000 to 50,000 newborns. What is it? A rare genetic disorder caused by a deletion on chromosome 5. When is it diagnosed? At birth or during early infancy? Where is the problem? On the short arm of chromosome 5. Why does it happen? A spontaneous genetic deletion that disrupts normal development. We also learned how Cri-du-Chat syndrome is caused, diagnosed, and treated. This has been your special report on Cri-du-Chat syndrome from Biology Daily. I'm Annalisa Konstantopoulos. Have a great rest of your day.